Good morning, everyone. I'm Mark Weeks, and on behalf of the Florida Alcohol and Drug Abuse Association, welcome to today's webinar entitled Vaping and Teens, Trends, Research, and Prevention Practices. This webinar is being made available through a collaboration of the Florida Department of Children and Families Offices of Substance Abuse and Mental Health and the Florida Alcohol and Drug Abuse Association. Please note that as an attendee, you are in listen-only mode and will only be able to view your name. If you have any questions, please send them to the presenter and me, the host, by using the Q&A panel. The button to open the panel is usually located on the upper right side of your monitor. Please use the Q&A panel to send any questions you may have as you think of them. The presenter will address questions as time permits. Our presenter has provided several ancillary handouts that support today's training. You may access these handouts now through the invitation email you received from Messenger at WebEx. Be aware, we will also post these additional handouts to the FADA Resource Center Training Library within 5 business days after the webinar today. Our audio is broadcast through the internet to your computer. If you experience poor computer audio, there are a few options to try on screen right now, and those options will be posted in the chat panel too. If you continue to experience poor audio through your computer, try rejoining the webinar and call in using the telephone I will call in option. You must be connected to the audio of this presentation and view it on screen as well as to receive your certificate of attendance. The recording of materials used in today's presentation will be available on the FADA website within 5 business days. To access the recording, go to www.fadaa.org. Also, a PDF version of this PowerPoint presentation will be emailed to participants within that same time frame. FADA produces many webinars and workshops through the support of the Florida Department of Children and Families. To help participants track credits earned through attendance, we host an online community that provides a personalized digital journal where participants can maintain statements of credit for webinars and workshops taken through the Florida Alcohol and Drug Abuse Association. At the end of today's webinar, the web browser will direct everyone to an evaluation form on the FADA website. You will first need to register or sign in to your account to complete the evaluation. Information you provide FADA as a part of registering remains confidential. Statements of credit will be posted within 5 business days after the evaluation closes in individual professional development journals for persons completing the evaluation and attending the full webinar. Completing the evaluation is necessary to receive CE credits or to access your statement of credits. Do note that the evaluation will close at midnight on Tuesday, October 23rd. 1 to 2 continuing education credits are available for participating in today's webinar. For persons licensed through the Board of Nursing, the Board of Clinical Social Work, Marriage and Family Therapy, and Mental Health Counseling, and for persons credentialed through the Florida Certification Board. If you are a licensed health practitioner, be sure to include your Florida license number for reporting to CE Broker when you register with our site for the first time. If you are certified with the Florida Certification Board or licensed outside the state of Florida, you don't need to provide your certification number when you register with our site. Note, please, that WebEx monitors arrival and departure of attendees and provides a report upon completion. We are not permitted to provide contact hours or a certification of attendance if you do not attend the entire webinar. We are not permitted to provide partial credit either. Jaime Houston-Mulligan has nearly 20 years of experience implementing and supervising evidence-based programs in the community and training professionals on the use of evidence-based treatments for treating adolescents. She is presently the director of the Contingency Management for Youth Addiction Program, where she provides expert clinical guidance and quality assurance monitoring for the providers of the contingency management and leads the program NIDA-funded research. In addition, she is on the staff of Penn State Hershey Medical Center, where she trains psychiatric fellows how to efficiently treat adolescent substance abuse. We are very pleased to have Dr. Houston-Mulligan join us today.
Good morning.
And now I'd like to welcome our presenter, Dr. Jaime Houston-Mulligan. I will turn the presentation over to her now.
Great, thank you very much. Okay. All right, so hopefully everybody can see the slides, and can you guys hear me okay? Okay. Okay, good. Just wanted to make sure we had some good audio here. So thank you for the introduction, and thank you everyone for joining us on this Friday morning. So we are going to talk about vaping. And as we all know, vaping is 100% safe. It's an excellent smoking cessation tool, and it produces no harmful effects, and it's just water vapor. Or at least that's what we're kind of led to believe up until this point, that it's a pretty safe, effective tool for helping folks quit smoking. As we've learned more about it, we're going to find out that that's not really true. That's more of a kind of a legend that has gone along with vaping as it has hit the marketplace. So let me get to the next slide here. Okay, so let's start with just a little bit of local information about the vaping epidemic, as we've started to call it. So according to the Florida Department of Health, there has been a substantial growth in vaping in the past few years among adults and teens. These tobacco control efforts are coordinated through the Department of Health Tobacco Free Florida, and you can access that information with the link that is listed there, and with a reach within all 67 counties. Tobacco Free Florida is really concerned about the public health implications of this vaping trend. Reason being is, unlike what I initially said, e-liquids contain nicotine. It's highly addictive, and nicotine is the fundamental reason that people continue to I just saw a note that audio is coming in and out. If other folks are hearing that, let me know. And it is a leading cause of preventable disease and death in the country. So the fact that vaping includes nicotine, we know that's highly addictive, and this is a troublesome trend. We need to be concerned about it. There we go. Sorry, I'm just checking the audio real quick. Okay. What we've found is that according to the Florida Youth Tobacco Survey, and this was just in 2017, I'm sure it's increased since then, the number of high school students using e-cigarettes increased by 72% in just 2 years. So that's a jump from 10% to 18%. And that's a very, very significant jump for any kind of substance that we encounter. I've listed along some of the slides quick links that you guys can go to once you get the PowerPoint, so you can kind of see the tables that went along with this. There's also a fantastic infographic that really summarizes the results. And today we're going to talk a lot about the data. I know that data can be a little bit dry sometimes, but the information about the data is important because what we found is the huge increase in teen use of vaping tools, e-cigarettes, is linked to kind of a lack of knowledge or a very strong misunderstanding about what vaping is and why it can be problematic for them. So if we're going to target vaping and we're going to help teens make better choices, then we need to be really well equipped with the information about why it's a problem and why they should be concerned as well. And here's just kind of a paragraph. I'm not going to read through it, but you'll have it in your slides so that you can use it going forward if you need to. But what they really found is that there's a really alarming trend in children and young adults trying e-cigarettes. There's evidence that teens who use them are more likely to start smoking conventional cigarettes. And this is very problematic because we know that nicotine use during adolescence can affect teenagers' brains, make them more susceptible to addiction in the future. And we really don't know enough about these products to make informed decisions about long-term health effects. So there is a lot of debate about e-cigarette safety and if it can be used to help smokers quit, if it can be considered a quote-unquote safe, I mean, it'll never be a safe option, but a better alternative to smoking. And as it says here, and we'll get into it later, the FDA has not approved these devices as cessation devices. You cannot use them as a quitting aid. They are regulated as a tobacco product. And so that's kind of where we're at. So that's just a little blurb that you guys can take with you if you need it about vaping. So what are we going to try to do today? We really just want to increase our knowledge about vaping and vaping amongst teenagers. We want to talk about the risks and the impact on health, and we're going to touch on some prevention tools and possible refusal skills that can be used to help teenagers who are using e-cigarettes and things like that. So let's just start off with what is vaping. And a lot of you are probably like, I already know what this is. But as I said, teenagers really don't understand. So if we can all get on the same page about kind of the definitions of what this is, we're better equipped to really educate teenagers and others about what vaping is. So in technical terms, when someone vapes, quote unquote, they inhale and exhale a vapor. And that comes from an electronic cigarette or similar device. Things like vaporizers, vape pens, Juuls, which we'll talk quite a bit about. So it's literally just inhaling and exhaling vapor is where the vaping comes from. The device used for this is just a very small battery-powered device. It heats the e-liquid, making it something that you can inhale in a vapor, similar to how steam is formed. Very similar process. Other terms that are important to know, and at the bottom you'll see I linked to this vapingdaily.com. They keep up to date almost daily on new terms that are coming out so that we can know what we're talking about. But for today's talk, I just kind of picked some ones that are important for us to know. So the atomizer, that's the actual heating element. So you know that that's the part that heats the oils or juices or whatever they're using to create the vapor. That's going to become important later on because one of the things that's come out in the research is that people that are modifying that atomizer or modifying that heating element can make the vapor far more dangerous. It releases far more toxins. So we need to know what folks are talking about, the heating elements, the atomizers, modifying, things like that. That's what they're talking about, is changing that actual component in that e-cigarette. The ENDS, you'll see that thrown around about quite a bit. That's just electronic nicotine delivery systems. That's just the term, but most folks just say ENDS. So that's what that means when you see that. The cartridge or reservoir, that's just the thing that holds the liquid. That's an e-liquid, an e-juice, so all different kinds of things. So they just call it the cartridge, the reservoir. There's lots of other terms, but that's what we're talking about there. Mods are vaporizers that can be modified or customized. And lots of folks modify and customize ones that aren't meant to be modified as well, which is where we get into the trouble. But there are ones on the market that are specific that you can modify. You can make them, look the way you want, act the way you want, that kind of thing. So those are your mods. Aerosol. This one's super important. That's what an aerosol is particles suspended in a gas. Why are we talking about aerosol? Reason being is because we know that the vapor that comes out of the e-cigarette is filled with particles. There's this long belief back when vaping started that it's just water vapor. It's no different than putting a pot on your stove to boil water for, pasta and, breathing in the steam. No, that's not true at all. It is considered an aerosol. There are actual particles in that gas that can be quite harmful, especially, as I mentioned, if you start modifying it, changing the heating elements, things like that. So it is an actual aerosol coming out. It's not just a vapor coming out. And then another one you might hear of is throat hit. People talk a lot about that. That's when the vapor hits your throat, it can cause it to contract. Lots of people find that to be very pleasurable, so they'll often rate the devices or the juices or the oils or whatever based on a throat hit or how good they think it's going to feel. So those are some common terms that you might hear a lot of that we'll touch on and bring up as we go, but I want you guys to kind of have those in the back of your mind as we move forward. Let's also talk about nicotine. I'm sure folks have a pretty good sense of what nicotine is, but I want to kind of get us all back on the same page because research has shown that teenagers really don't understand that when they vape, it's nicotine. They think it's just flavor, chocolate, pineapple, whatever the flavor might be that they've chosen. They don't understand that it's actually nicotine. So what is it? It is the actual stimulant that you get from the tobacco plant. It's not the same thing as tobacco. It's the actual stimulant that they're able to extract from it. And the extraction of it makes it very easy to absorb into the bloodstream. And you can take this nicotine and you can pair it with other chemicals, put it in the e-cigarettes, and then you can heat it up and vape it. So that's what ends up happening. So nicotine is just that stimulant from the tobacco plant. How does it work? Another thing that's important, because if teenagers aren't understanding that nicotine's in their vape pens, they're not understanding what it's doing to them. It's a yellowish, very oily liquid. As I said, it comes from tobacco, acts as a stimulant in small doses. Once it's in the bloodstream, it stimulates your adrenal glands. This releases your epinephrine, your adrenaline. When you release that, it impacts your central nervous system. It stimulates it. Your blood pressure is going up. Your breathing is increasing. Your heart rate is increasing. You're getting those physical feelings. But it also impacts the brain. It activates the brain's reward circuits, causes that dopamine to go up. That's that feel-good hormone. So when you ingest nicotine, it gets into your bloodstream. It's getting your body going. It's also getting your mind going. And it's making everything feel good. That's what is so addictive about it. And why we're seeing so many kids getting kind of hooked on vaping is it's filled with nicotine. They're not aware of that. And they're starting to have some issues. Now, what is the difference between e-cigarettes versus cigarettes? E-cigarettes do not contain tobacco. And this will become a little bit of a legalese issue as we move on and talk about regulation. E-cigarettes don't contain tobacco. Cigarettes contain tobacco and additives for flavor. E-cigarettes don't. They just have the nicotine that's extracted from it. When tobacco is burned, it becomes a smoke, as we all know, whereas e-cigarettes heat up the nicotine and it's an odorless vapor. So you have similar processes in a sense, very different outcomes. Cigarette smoking is very obvious. There's a smoke associated with it. There's an odor associated with it. It has a different feel to what the e-cigarette has. And e-cigarettes will deliver about a third to a quarter the amount of nicotine as you would find in cigarettes. Now, as I mentioned, with those modifications and the heating elements, you can change how much you can actually get out of it based on your vaping habits. But what we're typically seeing a normal off-the-shelf thing is about a third to a quarter the amount of nicotine as cigarettes. So why vaping? Like, where did this even come from? It seems like it all of a sudden kind of showed up on the marketplace, and you see folks on the streets and in meetings and kids in schools and bus stops, and all of a sudden this is a thing. Well, vaping started as an alternative to smoking. That was really the kind of push. A lot of it came from more of the traditional tobacco manufacturers looking for other ways to provide nicotine alternatives to folks. So it really became an alternative to smoking. And what you would see with those very first vaping devices is they look like cigarettes. They were designed to look like cigarettes. They were marketed as a healthier way to enjoy to enjoy nicotine without the tobacco, without the combustibles that come along with traditional smoking. So there was a very strong link in the beginning between e-cigarettes and smoking. And the original marketing was down that line is, hey, maybe you don't want to smoke anymore. You're tired of the actual smoke. You're tired of the tobacco. You want something else, but you still enjoy nicotine. Here's a great alternative to that is how it originally hit the marketplace. So that's how it came about with new technologies and things like that. We were able to get into this vaping revolution as a smoking alternative. And what we're going to see in a little bit as we start talking about adolescents is when that trend changed away from vaping as an alternative to smoking to vaping as its own standalone thing, let's not talk about smoking, we saw much more teen use as they started to the manufacturers started to try to break that link between vaping and cigarette smoking. So let's kind of dig into it quite a bit. As I said, vaping is inhaling and exhaling a vapor from your electronic device or something similar. What is an actual e-cigarette? It is a battery-powered device. It vaporizes the nicotine. It's meant to initially imitate conventional smoking. And as I said, those original vaping devices look like cigarettes. I'll show you some images in a few minutes, but the new ones have no resemblance to cigarettes whatsoever. So they were meant to simulate the feel and the look of smoking. Now they don't. The nicotine is provided through an insertable cartridge. So you purchase a cartridge of whatever you want, you insert it into the device, you inhale, and that causes the device to power up. So your actual inhaling powers it up, vaporizes the nicotine, and you get that buzz similar to smoking cigarettes from the nicotine, the vapor, but not from the smoke. So it's just a battery-operated device that's powered by your actions, basically. And here's kind of the breakdown of what it looks like. If we start on the right side here, you can see the cartridge goes in that holds the nicotine. We'll talk a little bit about the other chemicals in there, but propylene glycol is the chemical that's bound to the nicotine to help it vaporize. So it's not just nicotine and vapor, it's nicotine bound to chemicals. The heater vaporizes that nicotine, and this is where folks are able to kind of do some modifications by changing the heating elements. There's a little sensor that knows when you go to take a drag, it activates the heater, it starts to pull stuff out of the cartridge, and then you're able to inhale whatever you put into the cartridge. So that's kind of a traditional looking e-cigarette. As you can see, it looks similar to a traditional cigarette. Other devices on the market that you'll see, there's e-pipes, e-cigars. There's these in the middle, these large size tanks. Those are the ones that are most obvious if you're out and about seeing people use them because they just have an unusual look to them. You kind of have some smaller size tanks, and then on the far right, you have your more traditional cigarette looking ones. There are rechargeable ones, there are disposable ones. There's a lot of different options. But as you can see, a lot of these things look like traditional smoking device. It looks like a pipe, it looks like a cigar, it looks like a cigarette. In the middle, we start getting into the more original and unusual designs, and you'll see that has continued to go. Now, we wouldn't be doing a good job talking about vaping if we didn't talk about Juul. Juul is a brand name. It's a device created by, I think, some students at Stanford back a few years ago. And this is more of a closed system product. It's not meant to be opened. Of course, people are pretty tech savvy these days. They have been able to open them and modify them and change them and do all that, and that's problematic. But it was designed to be more of a closed system. It is something that you just recharge via your USB. You can plug it right into your computer. The pods contain a salt-based e-liquid, so it's a little bit of a different product. But each pod is equivalent to the amount of nicotine in one pack of cigarettes, and they're flavored. So this is where kind of the new creativity came into the field. When juuling hit the market, or Juuls, they call it juuling, hit the market, it was different. It was something new. It didn't look like a cigarette. It didn't look like a cigar. It didn't look like a traditional, tobacco product. It looked completely different. It just looks like a USB drive. It's flavored, and it packs a pretty strong punch of nicotine. So you can carry around one little pod, and you have as much nicotine as you would have in a pack of cigarettes. But just like the other ones, it still uses that heating mechanism to create an aerosol. We're going to talk a bit about juuling because this is the one that has really taken off with the teenagers. But let's kind of look at what they look like. Here are some of the devices. The traditional Juul device on the left, as you can see, it looks like a little USB. It's very small. You can hide it in your pocket. There's other ones that have come out similar, like the Mark 10 in the middle. Then there are, of course, ones that have been modified now that can accept marijuana, and that's on the far right. But they all kind of look the same. So if you have a teenager walking around and you may not necessarily know, is this one for the Juul cartridges? Is this for marijuana? What is this device being used for? It's very hard to tell because, as you can see, they're all starting to look a lot similar. So what is in a Juul pod? And I'm going to spend most of the talk really just referencing the Juuls because that is the device that is most used by teenagers. Teenagers have not adopted the traditional vaping devices. Of course, there are teenagers who have, but the majority have not. Smoking amongst teenagers has continued to go down. Teenagers continue to report less interest in cigarettes. They are not drawn to vaping devices that look like cigarettes at all. But the Juul coming out looking kind of futuristic and interesting and something you can plug into your computer is much more interesting. So we're going to spend most of the talk just about the Juul and the vaping that can be done with that device because that's the one that is most used. So as I mentioned, it doesn't just contain nicotine. It has propylene glycol and glycerin. These are clear liquids. They create that visible vapor. They are things that are found in medical, beauty, and food industries. There is nicotine in the pod as well. There's benzoic acid that's combined with the nicotine to provide a cigarette-like satisfaction to kind of give you that same feeling. There is a flavor, and the flavor menu is endless. And now it has become something that's easy to modify now that folks have learned to do it. So what we're seeing is kids can make their homemade recipes, which is a little troubling, or put marijuana in or various other things. So the Juul pod was meant to be kind of a closed device that couldn't be modified, but now this is where we're at now in 2018. Now, if you ask a teenager, juuling is not vaping. It's two different things. Study after study and survey after survey have shown that teenagers do not like vaping, but they're totally fine with juuling. And I think that's an interesting thing to notice. So Juul is the manufacturer. That's the device. It has over time evolved into becoming a verb, and it's now called juuling. So teenagers are not making that connection that juuling is just traditional vaping that they have seen people do, for the last decade or so. So they see Juuls as completely different than traditional e-cigarettes. They see no connection to that whatsoever. And the juuling term gives that impression it's not connected to nicotine. So now we have a really big disconnect. Teenagers are vaping, quote unquote, but they don't know they're vaping. They think they're just juuling, which is just enjoying some flavored concoction that they purchased or made in their house. So part of us targeting teen vaping epidemic is education about what it is, because they are not making that connection whatsoever at all. And you can survey teens, and they will say that, I would never smoke. I don't like cigarettes. Vaping is lame. I don't like it. Sure, I like juuling. And they don't understand that they're all talking about the same thing. Now, because of this, there have been a lot of prevention efforts that have really come about in basically the last year. And I'll show you a couple of graphs where we've seen that vaping or juuling amongst teens has begun to skyrocket. And at this point, Juul controls 72% of the market. They have kind of come out of nowhere and have dominated the marketplace in providing vaping devices and products. in large part because they were one of the first to come out there and offer flavored oils and juices and things like that. Now, an interesting thing has happened in the last probably half year or so. The FDA has jumped in and has said this is an epidemic. Teenagers are using these devices. We're creating a whole new generation of citizens who are going to be addicted to nicotine and don't even realize it because they don't know what these products are. And the FDA has really gone after Juul in particular for targeting to teenagers. And as early as August 2018, the FDA has started a very strong campaign investigating them. Juul, knowing that this was coming, in June, a couple months before this, launched their own ad campaign to educate parents about the dangers of Juuls for teens. So Juul kind of saw the writing on the wall, saw what was happening. Whether they are or are not directly targeting teens, I don't know. That will come out probably through the FDA investigation. But the reality is they've tried to get ahead of it. And if you go to their website, they do, and I'll offer the link, they do offer education materials now. They've put a lot of money out there, millions and millions of dollars, to try to do prevention campaigns now because they are starting to get a really bad name for targeting teens and contributing strongly to this vaping epidemic amongst teenagers. So it's kind of an interesting thing. There isn't a lot more to say about it at this time because it is so new. What is going on? The FDA is in the active investigation. Juul is actively trying to do some damage control and figure out how they can better package their product to not be so desirable for teenagers. So it'll be interesting to see how this all plays out and what impact that might have. Part of their ad campaign for education is to help folks understand that their products contain nicotine. That was something that was not really clear in the past, in large part because a lot of these newer companies realize that, connecting vaping to a cigarette alternative is not a great marketing strategy. Instead, let's talk about like a positive vaping experience. And that's kind of how we are where we are right now. So here's a little screenshot of their website. They show you what all their devices look like. Of course, you can order things online. You can get support. You can refer people to them. You could do all kinds of kind of community activities through their website, including their prevention tools right now. So I mentioned Juul is kind of a new device, but of course, as is true for the marketplace, there are always new devices. So I want to show you two more that are kind of pretty new on the market that are even more easy to modify. We have these Sorin drops, and we have these wax-penned vaporizers or vape pens, and those are specifically designed for herbal extracts. We know what that means. We all know what that means, but they're meant for like more herbal type of things. You can put different kinds of oils in them, that kind of thing. So these are what the drops look like. They're tiny. They're very easy to put in your pocket. They work just like any other device, but as you can see, we're really getting a shift from that original slide where we saw the pipes and the cigars and the cigarette copies to this, to USB devices, to these little drops that don't look like anything that someone would be able to basically smoke out of or vape out of. So it's really interesting that they're getting these. And you can change the colors. You can make it look like whatever you want it to look like. You can have stickers for them. You can really make them modified to fit your personality. So they're really something that I think is desirable to teenagers, of course. And then these are the wax pens. So here's a screenshot of Vapor Nation. This is a pretty popular website where if you ever, I know for me, if I'm working with a teen and I want to figure out what they're talking about, sometimes I'll just go right to the online stores and Google it or whatever. But if you ever aren't sure what somebody is talking about or you've seen a device and you're like, what is that even used for? These folks sell just about everything, and you can really see what it is and what these devices are used for and how much they cost and how you can get them and that kind of thing. So here's just a screenshot of these wax pens that come out. These are more for those herbal type devices, but I think the interesting thing is some of them look like pens. You wouldn't necessarily notice it in a book bag or in somebody's pocket or on their desk. It looks like a pen, so it's a little easier to it's more discreet, I guess. Now there's also this. They're called heat not burn devices, HNB. These are available online. These produce smokeless tobacco vapors by heating mini tobacco sticks into a vapor without burning or smoking. So it's similar to juuling, but now they figured out a way to have little mini tobacco sticks that will also vaporize without the smoke. So that's kind of interesting. This is something new that's coming out. People are reporting these are more satisfying than e-cigarettes. They deliver nicotine levels similar to cigarettes. So like I mentioned, the pods or the cartridges may only have a third to a quarter of the nicotine. These HNB, heat not burn, are pretty much comparable to cigarettes because now they're actually using tobacco sticks. These devices are new enough that they haven't been in youth surveys. We don't know yet if teenagers are using these devices, if they're aware of them, how they're using them. So as we learn more about these devices, they will be included in youth surveys, and we'll get some good information about teenager use. But this is another new one that's moving away from that liquid and getting into actual little sticks of tobacco, completely changing the marketplace in that way. So let's kind of talk about marketing. And part of why we need to talk about marketing when we're talking about vaping is because marketing has been found to be one of the biggest reasons why teenagers have jumped on this train of vaping. Up until recently, and even now, it's a largely unregulated market. Internet sales are 50% of the marketplace, so anybody can buy stuff. You don't know who they are. It's easy, very easy to get. As I mentioned, in marketing, the older brands come across as a healthier and cheaper alternative to cigarettes. They sell them as a substitute where smoking is banned. And in a second, we'll talk about what states are doing. Lots of places you can still vape, even in non-smoking establishments. So marketing says, hey, you can still, have your nicotine, even if smoking is banned in this restaurant or venue or whatever it may be. They're also selling themselves as a smoking cessation aid. And when we get to the legal part, we'll talk about why they're not allowed to do that. So lots of these companies have removed that, but they still suggest that it could be a smoking cessation aid without actually saying that, because they are not allowed to sell these devices or market them as that. But many people believe that the vape pens and the e-cigarettes are helpful in smoking cessation. The older brands still focus on nicotine content, and they still maintain that similarity to cigarettes. And as I mentioned, those new brands, their primary market or marketing strategy is not those 4 bullet points. They aren't talking about that. The newer brands are talking about flavors, experience. They're not talking about smoking. They're not talking about cessation. They're not talking about nicotine. They're not talking about how you can use it where smoking is banned. They're talking about the experience and the flavor and how much you're going to enjoy it. And as of 2014, this was 4 years ago, I can't imagine what it is now, sales were about $2 billion. So it is a hot market, and it's basically kind of divided into 2 camps. You have the folks calling it a cigarette alternative, and then you have the folks on the other side saying it's just a great experience with flavor, and we're going to have to see how the legal world teases that out. So here's a little information from the CDC about where advertisement is coming from. So for students, they are exposed to advertising about e-cigarettes all over the place. What the CDC found is about 14 million youth are exposed at retail stores, so they're just walking into any establishment and seeing them. 10 million are exposed through the internet, 9 through television and movies, and 8 through magazines and newspapers. So these products have hit all areas of the marketplace. You can see them when you're walking on the street. You can see them when you're on your smartphone, on your TV, if you're flipping through a magazine. They are in every single marketplace. And what they found is that overall, about 69% of kids are fully exposed to this, and there's not a lot of difference between middle school and high school. I think that's kind of interesting. And I think that's in large part because of the fact that you could get it through the internet and just walking in stores. I don't think a lot of middle schools are necessarily flipping through magazines, but what we're finding is middle school kids and high school kids are getting the same exposure, and their rates of use aren't a whole lot different. And what the National Youth Tobacco Survey found was that as the amount of dollars spent on e-cigarette advertising went up, e-cigarette use among youths went up as well. And you can see it's pretty dramatic. And this is only through 2014. I can't imagine what it is right now. But it's pretty clear that the advertising is linking directly to the use among youths. And that's interesting because the campaigns around stopping smoking, anti-smoking campaigns, anti-tobacco campaigns, use a lot of these same ways to target youth to try to get them to stop smoking. And they've been very effective. So it's interesting that folks can market these vaping tools, and it's increasing youth use. Well, that's hard to say. Teens vaping. There you go. It's increasing how much teens are vaping. So they are buying into the marketing. They are buying into the story that's being told about these products, and their use is matching that. So it's kind of interesting to see that the marketing is really having a very strong effect on them, and it's largely just misinformation about what's going on. So where are we at with sales now? There are 460 e-cigarette brands available. There are over 7,000 flavors. It's really kind of amazing. There are 10 new brands and 242 new flavors added per month. 80% of the sales are in convenience stores. Most of the products on the market are still from large tobacco companies. They own most of the vaping products. The other 20% is these smaller companies like Juul. And the majority of the sales, though, are online and unregulated. So most people just go online to buy these products. They're not as likely to just walk into a store to buy it. Most is just online. So where can you buy them? As I said, internet and retail shops, but it does differ by state. States are still trying to catch up with this to push through laws about where you can and cannot get this information. At the very bottom of this slide, publichealthlawcenter.org has a complete list of e-cigarette regulations and sale laws, and they update it constantly because this is constantly changing at the state level. So if you go there, you can look up a specific state, and they'll also show locales as well to tell you what the law is for where you're at. But so far, right now in Florida, e-cigarettes are not listed in the state's definition of tobacco products. We'll talk about the law shortly, but there's a reason for that. They don't yet have specific regulations for packaging or special taxes. So, cigarettes might have specific packaging laws about, what's in them, content, things like that. At this point, you don't need a retail license or permit to sell them. But there are some good laws in place about youth. You cannot sell to anyone under 18. Possession of nicotine dispensing device or nicotine products is still prohibited for under 18. And you can't have self-service displays anywhere where there's folks under 18. So still trying to tease out the laws around packaging and taxes and all of that, which we know is probably a mountain to climb, but definitely very strict laws about youth having access to these devices and the nicotine product. Oops, I'm sorry, I jumped too far there. Let me go back up. At the top, there's also another link, and the reason I included so many links in this presentation is because the information is literally changing daily. As new laws are passed, as the FDA goes forward with their investigations, as the Surgeon General comes out with reports, the information about the safety of these products and how accessible they are, it is constantly changing. So what I told you today could be very different on Monday. So it's nice that you can go and just look up current information about it. But nosmoke.org keeps an ongoing list of state and local laws. And this is where the current count is, which is pretty interesting. So we know that there are 100% smoke-free venues. There's lots of places where you're not allowed to smoke anymore. But only 13 states restrict e-cigarette use in smoke-free venues. That means the vast majority of states in the U.S. still allow vaping in a smoke-free venue. So you can vape anywhere you want, basically, in the majority of the states. They're trying to change that as the research has come out about the fact that the vapor that comes out of them isn't actually just water vapor. It can be dangerous. But it takes a long, long time to change that, and you need to know what the evidence is to support that change. So right now there's only 13 states that have any restrictions on e-cigarettes in smoke-free venues. Only 15 states have laws restricting them in other venues. Local laws, these are your local townships, your counties. If you think about how many townships and counties there are in the U.S., hundreds and hundreds and hundreds, only about 750 have any rules about using e-cigarettes in smoke-free venues. Now, part of this is only states can enact taxes and smoke-free laws. So each state has to kind of labor through this process and figuring out what are we going to do about vaping. And the tough thing is that the little legal sticky point is that the vapor and the oils, it's just nicotine. Lots of folks have laws about tobacco, but these products don't actually contain tobacco. They contain nicotine, which is a byproduct of tobacco, as we talked about, but it doesn't actually contain tobacco. So you get in this kind of sticky situation where you're trying to maybe enforce your tobacco laws to restrict vaping, but you're getting yourself in some hot water because the manufacturers can come back and say there isn't tobacco in this product. It's just nicotine, and now we have a problem. Now, there have been more laws about purchases and use. So folks are still battling how we're going to restrict vaping in public places, but they've been a little more quick to jump on purchase and use. Lots of states have passed laws establishing a minimum age to purchase. I think most states have at this point. Unfortunately, at this point, manufacturers are not required to list ingredients or nicotine strength on their products, but that is something states and the FDA are currently going after. They want them to have to list ingredients and the nicotine strength on them, almost like, percent alcohol on a bottle of wine or something. They're going to require nicotine strength assessments on the packaging. That's something that people are actively going on about. They also want the containers to be made child-proof, and we'll talk about safety towards the end. Lots of kids have been killed or ended up in the ER ingesting this. They want the containers to be made child-proof. That's another thing that's going on right now. And in 2016, they were able to start classifying e-cigarettes and e-liquids as tobacco products. So I mentioned that that's something that's still in the works a lot of places. There's been some preliminary legislation that's allowing that to happen. So that's kind of where we're at right now. Lots of folks it's been very easy to establish a minimum age, but they really want to see ingredients. They want to see childproofing. They want to see this clearly designated as a tobacco product. So that's kind of where we're at with that. Now, the FDA of course, does their own thing here. The FDA is able to, someone just asked the question, how do you regulate minimum age laws with online sales? That's a good question. You can't. What you could do is if you're able to figure out that the online vendor is selling to someone underage and you can clearly show that, you can go after them. But I don't know if you've gone to, I'm in Pennsylvania. We have very strict laws about alcohol here. Maybe this is true in every state. I'm not sure. But if I go to like a vodka website and want to look up products or something, it makes me put in my birth date and say my age, and then I can get through. I can put any birth date in I want. I can say whatever age I want. That's just their little way of protecting themselves, saying, look, we ask for age. That's really the only thing that could be really done at this point online, is to require those companies to have that same kind of pop-up that shows up when you go to their website, that you have to enter your birth date, age, and that information in order to access the product. Right now, anybody can go to the sites, log in, or order them, send them to their address, that kind of thing. There's really no way to regulate that right now, which is, I think, is going to be an issue that we're going to deal with for a long time, of course. So the FDA regulates cigarettes, cigarette tobacco, roll your own tobacco, smokeless tobacco, that kind of thing. They regulate all of those things. They now are able to include e-cigarettes, including cigars, hookah, all that fine stuff, under the same tobacco authority. I don't know how long that's going to last. It may stand up the test of time, but some folks are really starting to go after that, again, with that argument that this is not a tobacco product. You cannot cover it under your tobacco control authority. But as of right now, they do. And what they were hoping to achieve by kind of pulling vaping in under the tobacco control is to increase regulation. If they can pull it under tobacco control, they can ban the sales to minors. They can require those health warnings, including risk of addiction statements. It's looking like in 2019 that might become part of the law that the companies are going to have that information on there. By being under tobacco control, they can prohibit the vending machines. They can require the ingredient list. The FDA would have the authority to approve marketing plans. The FDA would be able to approve any claims made by the manufacturers about what these products do for you. They could ban free samples. So by rolling them under the tobacco control, it's going to give the FDA a lot of authority to manage these things. It's not all of this is in place yet, but that's what the goal is, to enable them to do these things. Now, there's, of course, critics. Critics say that the FDA should go even further. You need to halt online sales completely. You need to prevent TV and radio ads. You need to ban the marketing of flavoring, because we know that flavoring is one of the biggest issues that has brought teens to these products, is they like the chocolates and the pineapples and the bubble gum and the 7,000 flavors that are available. Others say no. These laws are too strict. It's not fair to regulate this way. It's going to halt innovation. And then lots of researchers are actually on this bandwagon. They're saying, hey, we can't yet call these smoking cessation devices, but there's a lot of potential here. If the market is allowed to continue to innovate, we might be able to come up with some actual safe devices to help folks quit smoking, and that would have a wonderful effect on human health. If you overregulate, people are going to stop innovating. So there are good arguments on either side, and they're still being argued today. So that's kind of where we stand. It's interesting to see public health researchers saying, you know what, you can't overregulate this. We need to innovate because there's a lot of potential in these devices. Yes, it's causing kids to become addicted, so we definitely need to deal with that. But this could also help a lot of people as well. So kind of an interesting debate going on right there. As of September 12, 2018, this is where we're at. The FDA came out with a very strong update. They declared teen use of e-cigarettes having reached epidemic proportions. They don't use those terms lightly. So it shows you this is a serious problem. Teenagers are using these. They're becoming addicted. And in a second, we'll jump to talking about teenagers specifically and how we're really seeing e-cigarettes as a gateway to more marijuana use, to conventional cigarettes. It's very problematic. The FDA gave the manufacturers 60 days. All of these manufacturers have to prove they can keep their devices away from teens. This is both the makers and the sellers of these devices. They have 60 days to report back to the FDA how they're going to do this. If they can't prove it, they have to remove all flavored products from market and face civil or criminal charges if they sell this stuff on their websites. This is pretty tough. You don't often see this kind of stuff come down on people. They also sent warning letters to 1,100 retailers, including some big ones, 7-Elevens, Walgreens, Circle K, Shell. The list is endless, and they issued 131 fines. The FDA is taking this very seriously. We're seeing through youth surveys and a lot of the data coming out in ER, emergency department reports, that vaping is a serious problem among teenagers. We're having a real issue. So the FDA is really going at this full on. Part of it is safety. Poison control calls have increased. 2010, vaping was around, not as hot as it is now. Poison control centers reported about a call a month. 4 years later, they're up to 215 calls. 1 year later, they went from 215 to 3,000 calls a month. I don't have the latest data. I don't know where they're at right now, but 3,000 calls a month is really high for that. We know there have been at least 7 young kids accidentally ingesting e-liquids every single day, and that can cause coma, seizures, breathing failure, death. It's very, very dangerous for young children to be around these products. So that's part of the push as well, is we're seeing a generation of teenagers getting hooked on nicotine through these devices. We're seeing that these devices, the pods and mods are not secure, so young children are having severe health reactions to them. It's very problematic. So we'll talk about health effects, and then we'll take our break. So unfortunately, it's a short section because we don't know a lot about the health effects. This is such a new product, and we don't have those long-term users that we can study. Unlike smoking, which we can study generationally, we don't have enough people that have been using these products long-term that can tell us what it's going to do. And the other thing that makes it really, really difficult is the huge variability in ingredients. We could have one researcher in one place and one in another think they're testing the same thing to try to figure out the harmful effects, but there's so much variability in the ingredients. It's so hard to tell what the manufacturers are putting in them that it could vary week to week on what you're testing, which makes it virtually impossible to make any definitive statements about risk. So what we've found is if you look up the data on this, depending on how you search for it, you're going to find two different things. Some studies show there's minimal toxicity in the vapor. They're finding there's not a lot that comes out in the vapor. So as far as like secondhand smoke, quote unquote, it's not as much of a problem. Others find that the vapors coming out of these devices have all the same compounds found in cigarettes. So it's not producing a smoke, but the stuff that's in the smoke is being found in the vapors now. And so you look at this and you think, why can't anyone get to a consensus on this? Is it safe or isn't it? We have no idea because, like I said, no long-term users, huge variability in ingredients. But then the third one is the heating process can dramatically change the chemical compounds. So depending on how well the product is manufactured, and maybe I could buy two devices from the same manufacturer, and one has an effective heating device. The other one's a little flawed because they're putting these out in the marketplace so quickly. I, as a user, wouldn't even know what I'm ingesting because the heating process changes those chemicals. As the temperature goes up, the amount of toxins goes up that come out in the vapor. So that's the only thing we do know is that regardless of the ingredient, how hot that heating element is going to push more toxins into you as you use the product, but also out into the environment as you exhale to those around you. We also can't test because users can modify their devices and mix their own flavors. So we could have a study, and as someone who does research on addiction, this stuff just gives me heart palpitations. You could have a whole study of participants, and you find out that a few of them have just been modifying or making their own flavors. Well, now you have no idea what you're testing. Absolutely, they've modified their device. Maybe it has different heating processes. Maybe they've changed how much they can get through each inhale. Maybe they've mixed their own flavors, and now we have absolutely no idea. It's just a big mess. And most of the focus to this point has been on the nicotine content. That's what people have been really interested in. We know nicotine is addicting. So a lot of the research has said, well, we need to figure out what's the nicotine content. When you inhale, how much are you getting? How much is in your bloodstream? We haven't really looked at the other ingredients and byproducts as much because when they hit the marketplace, the original concern was, this is a product that delivers nicotine in a new way, in a vapor that can be easily absorbed. We need to worry about that. And now as we're learning that there's other stuff in them, we have a whole host of new things that we need to study. So the health effects aren't particularly well known yet. What do we know? We do know for a fact the vapor is not just water. You might hear it's just water. It's no different than going to the spa and sitting in the sauna. No, it's not. The vapor is not just water, as we talked about. It has particles in it. It's an aerosol. We also know the nicotine levels can be very high. We know it's a third to a quarter of traditional cigarettes, but it's all over the map and it can be very, very high. As a liquid, nicotine is incredibly dangerous. There have been recorded deaths of children. People have committed suicide by ingesting just the liquids. The nicotine liquid is very dangerous. We do know that. We also know that the more experienced someone is at using the e-cigarette, the more they're able to inhale nicotine. So that's kind of interesting. So there's quite a skill, I guess, for using e-cigarettes. Inexperienced users aren't as efficient, I guess you could say, or effective in reaching the nicotine. And what they found is experienced users kind of change how they inhale. They have a whole different way of using this device that they've trialed and errored over time. So as you use the devices more, you will get more nicotine as you become more skilled at using them. That's kind of interesting to note. So you might have a teenager who's using these devices, but the more they use them, the more they're going to get, and they don't know that. They don't understand that the hit that they're going to get of the nicotine is going to be more over time as they get more experienced. And the overheating increases toxins and risk. So we know these 5 things to be absolutely certain at this point. Oops, my slide won't progress. Let's see here. What are we going on? Sorry, guys. I'm not sure. You know what? Why don't we take a break right now because we're at 11 o'clock anyhow, and then I can figure out why my slide won't progress, and we'll be back in action in a few minutes.
That is an excellent idea. We'll take the break and meet sharply back at 11:05. Also, there are questions in the all chat. Perhaps you can get to those after the break as well.
Yep, absolutely. Thanks.
All righty. We'll meet back here at 11:05. Thank you all. Okay, Jamie, before we get started, have you been able to move the slides over?
Yep, seems to be working just fine.
It didn't on my end. Can you try again? Oh, there we go. All right, I just had a bit of lag. Yeah, all right. There's a few questions in the alt chat. I don't know if you can see them or not. I can read them out to you if you can't see them.
Yeah, I can see them just fine. Thank you.
All right. It's your show.
All right. So we had a great question in the chat. When states legislate to impose taxes on tobacco and possibly marijuana and vaping products in the future, aren't they really supporting these products in a sense because of the potential to generate revenue for the state? That's a good question. I don't know if I want to answer that one. My personal belief would be yes, of course. But what we found is actual taxing decreases use as the product becomes more expensive. People will make decisions about not using them. So you could argue that if they become taxed, they'll be more expensive, which makes them possibly less accessible to teenagers. I don't know. I'm not sure of all the data on that, to be honest with you. But yeah, it's always a sticky line to walk on of, well, let's just tax these things and then we can make lots of money. And now we're hooked on that money for the state. So now do we have an incentive to stop the use? Well, I mean, yeah, you could argue that the health risks and the costs to the poison centers and the emergency rooms and the healthcare system is very big. So you kind of have to do the math to see if it makes sense. But yeah, I mean, it's always a question people ask is, aren't you kind of indirectly supporting it if you then allow the product so that you can tax it? So that's a good question. Someone asked, do you have any numbers on how much revenue these retailers are earning from this industry? It's a multi-billion-dollar industry. The interesting thing about it, though, is it's an international industry. There are many countries that have out and out banned it altogether before it could even become a problem. I know the U.S. is the leading country that uses these products. The U.K. is right behind us. They're growing rapidly and it's starting to stress their healthcare system. But there are a lot of countries around the world that just said, no, this is not something that can be sold here. We're not even going to go down this road. So that being said, the fact that it's multi-billion-dollar industry is pretty telling, since it's not really, it's an international product, but it isn't really. I think I just pulled up some of the numbers during the break. The projections are it's going to hit about $61 billion in the next few years. And the reason being is, as we'll talk about soon, these products have now been modified for marijuana use, which is going to just skyrocket the use of these products. And I saw another one. Do smoking cessation medications like the patch help? That's a great question. No, I don't know that anyone can answer that one yet. I just pulled up the most recent study on that through the National Library of Medicine at NIH. They have studied one person who was able to effectively use the product to stop vaping. And that's kind of where we're at with that data, is we have a 24-year-old male who was able to be successful. So some of the preliminary information is that, yeah, we might be able to use things like the patch and other cessation tools to help people stop vaping. The biggest issue that they noted in this study, though, is that there are no treatment protocols for this. So you might have someone come in who wants to stop vaping and might want to use things like the patch or other medications. There are no protocols available. We don't know what to do in order to prescribe these kinds of solutions. So we have one person who's been written up in a case study who's shown that it can work, not necessarily generalizable off of one person. But the biggest issue noted by this research team with NIH is that we don't have any protocols. We don't know dosing recommendations. We don't have anything like that. So it's a tentative maybe that we can do that. So we talked about what do we know about health effects. What else happens? So there are side effects. Immediately upon using, you might have some throat and mouth irritation, dry cough, nausea, headaches, dizziness, blurry vision, abdominal pain. So, kind of the things people often report when they, take that first cigarette hit. A lot of the similar side effects. We also know there are some health effects and risks that are coming out. Now, I said we don't know a lot, but we're starting to see some good information based on what we're learning about the byproducts in them. So like I said, we had started researching vaping to look at the nicotine, started realizing there's other products and ingredients in them, and we know what those do to you, so we can make some abstractions from that. There is evidence that propylene glycol is a lung irritant. That's in all of the vaping devices. That is present in all of them. That is a known lung irritant. So we need to look into that. We also know that, blood pressure and heart rate goes up when you use nicotine, so we don't necessarily have to test the devices for that. We know nicotine does that. And we have some very, very early studies showing that cells exposed to the vapors show similar genetic changes as those exposed to cigarettes, possibly leading to lung cancer. We can't make a causal connection just yet, but we're seeing some cellular level changes that the body reacts in much the same way as it does to traditional cigarette exposure, which then could increase your lung cancer and other lung issues. So we're starting to see that. We know that's coming out. Lots of talk about popcorn lung now with vaping. That's diacetyl. That is a flavoring chemical that has been popping up in all of the vaping devices, and we know that it is linked to popcorn lung. So what is popcorn lung? Well, diacetyl is a flavoring chemical. It was found in microwavable popcorn. What we found is people who manufactured microwavable, I think I spelled that wrong, I'm sorry, microwavable popcorn, we're starting to get lung cancers and this thing called popcorn lung, very severe respiratory disease. It cannot be treated. They have now found that chemical in more than 75% of these flavored e-cigarettes. Now, I mentioned flavored because that's where they're showing up, these newer devices with the flavoring that teenagers are the biggest market for. Obviously, we need more research to prove or disprove that link, but that chemical is known to cause this popcorn lung, and it has absolutely been found in over 75% of these products. So that's very scary considering, like as I said, teenagers are the main marketplace for that. We also know there's benzene. Benzene has been found now. That is something from car exhaust and heavy metals. That is a known cancer-causing chemical, leukemia and other cancers. That is in them as well, we now know. So you have nicotine, you have your diacetyl popcorn lung, you have your benzene. It's not just vapor, it's not just something that tastes like chocolate. It's actual cancer-causing chemicals. Now, I say this, we can't make that connection yet. We can't say, if you use an e-cigarette, you're going to get popcorn lung and leukemia. We can't say these things. What we can say is we now know these things are present in these devices, and we need to determine what impact that's going to have on severe respiratory disease and cancer. We have to figure that out. But it's a very good warning to folks that these are in these products, so they're not, quote unquote, safe as we were led to believe. So let's jump into adolescent health, because now we've painted a pretty scary picture that these devices are targeted at teenagers. They're flavored in things that teenagers like bubble gum. They're modifiable. They can put stickers on them. They make them look cool. And it has very scary chemicals in them. Well, as we all know, adolescence is a critical time for brain development. This is when all that fun stuff is going on in your brain to make you into who you're going to be. Nicotine exposure at a young age can cause lasting harm to brain development. It does promote addiction. It can lead to sustained tobacco use. That is the statement from the CDC about nicotine. We know it has a negative impact on adolescent brains and then long-term health. According to the Surgeon General, these brain risks are pretty clear. It can cause mood disorders. It can cause a permanent lowering of impulse control. So kind of a failure to fight an urge or impulse to harm oneself or others. That can be a permanent impact of nicotine use. Months ago, we did a presentation on adolescent substance use, and these things all are similar to traditional illicit drugs, but people don't always make that connection to nicotine. The nicotine is just as damaging to teenage brain development as a lot of the other drugs that they may be using, and teenagers don't understand that. And as I said, I know I've repeated over and over, but it's really the key takeaway from this presentation that teenagers don't understand that e-cigarettes have nicotine in them, and that nicotine is an addictive drug, and it's going to permanently impact their development. So kids that would never have smoked before are vaping because it seems cool and not knowing that they're basically smoking. So mood disorders, lowered impulse control, changes in way your synapses are formed. So as your brain's developing those synaptic paths, it's going to impact attention and learning, and that becomes a lifelong issue. That doesn't go away. So kids that are using these devices are permanently impacting how their synapses are formed. It's going to make it hard to pay attention and learn going forward, which is going to impact education, career, relationships, things like that. And I know I'm saying this and I feel like I'm being very dramatic because kids smoke and it's not the end of the world, of course. But the vaping revolution is just such a different beast that we have to deal with because it's such an unknown. There's no way to know how much nicotine is in these products. We know that as kids use more, they get better at pulling nicotine out of it. We know they're encouraged to modify them and make them very dangerous. So we really have to take this seriously if we're concerned about adolescent health. And of course, as we talked about very early on, it impacts the brain's reward system, nicotine addiction, and we know for sure that it can make drugs such as cocaine and methamphetamine more pleasurable to a teen's developing brain. It kind of primes your brain to like those things more. So if kids do make that jump to other drugs, it's faster moving into an addiction with that as well. Lots of brain risks, lots of information, information from the Surgeon General, and then things from other researchers. You'll see different notations, number 7 for the citation, so you can look it up yourself as well. We also, there are behavior risks. And this one we actually know a lot of information about based on the youth surveys and what we've been learning. E-cigarette use with teens strongly linked to use of other tobacco products, cigarettes, cigars, hookah, smokeless tobacco. That link's been pretty strongly established. If a kid's using an e-cigarette, it's a slippery slope into these other things. We have some very, very preliminary research showing a link to alcohol use and marijuana initiation. So e-cigarette using teens are more likely to drink and more likely to make that first step into marijuana. And we know very clearly now these e-cigarette devices can be used for other drugs like marijuana. So it's very easy for kids to use. So a kid that maybe wouldn't want to smoke marijuana can now vape it and believe it's slightly safer for them. Obviously, they're not right about that. The other note from the Surgeon General is vaping does not protect. That is one thing that has been misinformation, I would say, that's been out that, well, you know, kids are vaping, but at least they're not smoking, or at least they're not doing this, or, you know, so-and-so used to smoke 2 packs a day, now they're vaping, much better. What has been made very clear is vaping is not protecting anyone from anything. What we found is non-smoking teens who vape are more likely to try conventional cigarettes in the future than non-smoking youth who do not vape. So kind of let that sink in for a sec. You have 2 different groups of non-smoking teenagers. These are teenagers who, based on our past research, we know would likely never start smoking. They're just non-smoking teens who would never make that jump to cigarette smoking. So you have your 2 non-smoking teens. One of them decides to start vaping because they think it's safer. They are exponentially more likely than to start smoking. So in the past, if vaping hadn't been available, they'd remain in that non-smoking teen group. But now that they've made that step into vaping, they then move into smoking cigarettes. And among high school students who use tobacco, more use e-cigarettes and burned tobacco products than e-cigarettes alone. So that's another really interesting one. So the argument that e-cigarette use decreases tobacco use or might help kids, you know, not smoke cigarettes has just been proven to be false. Kids using e-cigarettes are using e-cigarettes and regular tobacco products as well. That's what we found. Is it's not e-cigarettes alone. They'll start off with e-cigarettes, and then they progress into smoking, and then they're using both, which we have no idea what the outcome of using both of these products is on you. But it's become very problematic, obviously. And finally, addiction. Nicotine is an addictive substance. We need to get kids to understand that. And the CDC has come out with a very clear report that vaping doubles the odds that a user will advance to cigarette smoking. So we have those non-smoking kids. We might have that group of kids who would start smoking in the past, but then vape instead, thinking that's a safer alternative or a better alternative, but then we find out they're twice as likely to move on to cigarette smoking. So it's just really a clear gateway drug in a sense, to use that term. There are also psychosocial factors. Lots of studies out that are very interesting, surveying youth about what do you think about e-cigarettes? Well, approval and use of them among friends and family strongly is associated with use, obviously. If your friends are using, if your family is using e-cigarettes or even traditional cigarettes, you're just more likely to use. We've known that. So all that research on cigarette use and when kids are likely to start using, the outcomes are basically the same for e-cigarettes. You can almost substitute the same. If your family smokes, you're more likely to smoke. The research has shown if your family uses e-cigarettes, you are more likely to. Same with your friends and your peer group. So other psychosocial factors, there's just a very clear perception that e-cigarettes are harmless. Like just across the board, teenagers report that they believe they're harmless. And they also report something interesting, that e-cigarette use is completely acceptable. It is no longer really acceptable to smoke amongst today's teenagers. Obviously, we still have teens that smoke, but by and large, that's looked down upon amongst today's teenagers, whereas e-cigarettes is not. That's kind of the fun, cool thing you do at parties. Nobody's looking down on anyone who's doing that. No one's getting ostracized for it. It's just considered kind of like a cool, fun thing to do. So that, of course, makes it harder to quit as a teenager if it's just completely socially acceptable. So let's talk specifically about teen vaping. So the New York Times, obviously not a research article, but they went around and they just talked to teenagers. They wanted to learn, what are kids saying? Like, what's the language they're using? And, here's what they came back with. I'm on probation, so I can't smoke marijuana. And I don't want to smoke cigarettes. And I think cigarettes taste nasty. I like the feeling of it. The lightheadedness. It makes me feel sober and high at the same time. It looks sleek. You don't look suspicious. So this is kind of the narrative that's going around with teenagers is, I can get away with it. It's discreet. Cigarettes are kind of gross. It still gives me that fun feeling, and no one's suspicious about what I'm doing. That's concerning. Now, specific to youth substance use, so the Florida Youth Substance Abuse Survey came out, and in 2016, vaping and e-cigarettes were added to the survey. So now we have some good data at the state level about youth use. So 1 in 4 Florida students surveyed reported lifetime use of these products. That's 25% of students saying they've used them. 1 in 8 middle school students reported 1 or more lifetime uses. That's a big number. 1 in 3 Florida high school students reported 1 or more lifetime uses. Again, very big numbers. And 30-day prevalence rates were lower for middle school at around 4% and 10% for high school. So 10% of high school students are reporting using these in the last month. These are considerably higher than cigarette numbers. Considerably higher. So it is definitely something that Florida youth are using at a middle school level, at a high school level. And as I said in kind of the slide up here from our little New York Times little expose, they think it's kind of fun and cool and sleek, and it's not suspicious. So it's not surprising we are where we are. There was a very positive finding to come out of the 2017 survey, though. There has been a drop in reported 30-day use. So that's fantastic. So there's been a drop for middle schoolers from 5% to about 4%, and for high schoolers from 31 to 10. That's a big jump. So what's going on in Florida with the educational campaigns and getting people to know what's going on is having an effect. Teenagers are reporting less use. And they also found just on an adult level that use of e-cigarettes in Florida decreases as a person ages. So as folks get older, they age out of the e-cigarette use. So problems here, lots of kids reporting use, but the next slide makes it clear that something's working and the use is going down, which is fantastic. And then just some general e-cigarette stats that might help educate kids. E-cigarettes are the most commonly used tobacco, I call it tobacco product, but I guess nicotine products amongst youth. In 2016, there were 2 million middle and high school students using them. Numbers at the national level are pretty comparable to the Florida state level. And as we know, it's a very clear link from e-cigarettes to future smoking. The interesting fact from National Academy of Medicine, though, is we know that if kids vape, they're more likely to smoke. We've also found that if kids vape, it is likely to increase the frequency and amount of cigarette smoking in the future. So let's let that one kind of sink in for a sec. So kids who vape are more likely to smoke. If they do move from vaping to smoking, they smoke more than people who didn't start with vaping. So they are the more, 2-pack a day kind of folks, the chain smoking, the more hardcore smoking, whereas folks who just went and started smoking without vaping first don't have that same frequency and amount. That's a really, really interesting finding that has recently come out, that vaping almost primes you to smoke more than you would have if you hadn't vaped first. I'll be curious to see, how that comes about, what triggers that. And some other stats, just so we all kind of keep up with what's going on. 90% of all smokers first tried cigarettes as teen. 99% start by age 26. So if we can get in there earlier, the better. We can stop lifelong use. 75% of teen smokers continue to adulthood. So if they do start vaping or smoking in childhood, majority of them will stay smokers as adults. Interesting stat, if a teen starts using e-cigarettes by 9th grade, that seems to be the magical cutoff, they're more likely to smoke within the year. So it's kind of a rapid acceleration. I probably should have put that in a graph form to make it really clear. But if a kid's vaping before 9th grade, it's about 12 months, no more than 12 months, I guess I should say, before they transition to smoking. So it's a very rapid transition. For high schoolers, if they start vaping, they're 7 times more likely to smoke within months. So it's even faster. However, youth who smoke cigarettes do not report an increased risk of transitioning to e-cigarettes. So it's not a two-way directional thing. It's not like, well, I smoke cigarettes, I'm gonna transition to vaping, or I vape, I'm gonna transition to cigarettes. It's not two-way. Vaping leads to smoking cigarettes. Smoking cigarettes does not report any increased risk of vaping. So it's kind of a one-way road with that. So just to be clear, the studies are pretty clear. Studies show that e-cigarettes encourage cigarette use in teens. We're pretty sure of that. And as you can see here, it's been a rapid change. The bar on the left is e-cigarettes, and the bar on the right is cigarettes. So you can see in 2011, cigarette use was very high. Now here we are, the latest data is 2014. It's completely flipped. E-cigarette use is far exceeding cigarette use, and that's a very big change in 3 years. That's pretty amazing. So most e-cigarettes contain nicotine, which leads to addiction, may harm brain development, could lead to continued tobacco product use among youth. Very clear. The CDC has lots of these little images that you can download and infographics that you can use if you want them for your office or presentations you can use them for. So I just threw one in here so you can kind of see the marketing information that they've been putting out in the educational campaigns. They're trying to make it really clear to teenagers that e-cigarettes have nicotine. That can cause addiction. We need folks to understand that. Now we got to talk about dripping. That's something new going on. So 25% of the e-cigarette using teens report using e-cigarettes for dripping. So what they do when they drip is they place the e-liquid directly onto the heater, those atomizers. They drip it right onto the heater. They just unscrew the thing and put it right onto the heater. There's no inhaling and all that. What this does is you get a thicker vapor. They report it improves flavor. They report it has a stronger throat hit. So that one thing we talked about an hour ago, about that feeling in your throat. It also creates a hotter heating coil. Now, the teenagers don't know this, but studies have now shown that have investigated what this dripping trend is. When you drip the product right onto the heating coil gets a lot hotter, and that increases the cancer-causing chemicals very, very quickly. So this is something new teenagers are doing. They put the product right on the heater. They think it makes a better experience. We know it actually creates more toxins that can cause chemicals. And what is the general appeal to teens? And we've talked about this, but curiosity. They just want to know what it is, the taste, belief they're safer, and the marketing. There's lots of bright colors. There's lots of talk of flavoring and images, lots of sexual content in the marketing for these products. Very appealing to teenagers. What do teenagers know? Well, 63% of teens to young adults didn't know the vapor pods contain nicotine. 63%. That's pretty notable. That's a big number of folks using a product that they know nothing about. When you ask, what is it that you do then when you vape? I'm just inhaling flavoring. That's all I'm doing. So they just don't understand what they're actually using. So no talk of vaping will be complete without talking about vaping and marijuana. 18% of e-cigarette high school users vape marijuana as well. That's a pretty big number. Stats show us that teens who use e-cigarettes are up to 4 times more likely to use marijuana later than folks who didn't. And 18% of high school e-cigarette users vaped marijuana. Very big numbers, really kind of concerning, of course. Vape pens are a very easy way to use drugs. You can modify your existing ones, but now they also sell ones, of course, that are specific for marijuana use. But it's very easy to hide. It looks just like a common item, like a pen, USB drive, or a stylus you might have for your device, like we saw in the images. They can use these in class and on the bus because whether they're vaping the nicotine oils or juices or they're vaping marijuana, it remains smokeless and odorless. So they could be using these products pretty much anywhere, and it would be very unclear what they're using. And even if it is determined a kid is vaping, you don't know what's in it. It could very well be marijuana that they're using. So here's a screenshot of this site, redeyechronicle.com. I think it's always important to know what information's out there that teens are looking at. This is a website that provides instructions on how to vape marijuana. It's an incredibly popular website. It's like a how-to. It's like marijuana for dummies in a sense. So it's very easy for teenagers to get information on how to modify their devices, how to find marijuana products that they can use. It's just super easy to get this on the internet. So how do you know if a teenager is using? They think it's safe, it's easy to hide, so it's hard to catch, it's hard to intervene. Well, they won't have smoke on their breath, of course, but they will smell sweet, most likely. There might be an odd sweet odor about them. When they smoke traditional cigarettes, it's kind of easy to know. Vaping's a little more difficult, but they might smell like pineapple or lemon or whatever. They might have just a sweet smell. They will also show signs of nicotine withdrawal. So like I said, these things are full of nicotine. They're going to have the same withdrawal symptoms: feeling sad, trouble sleeping, irritable and on edge and grouchy, trouble thinking clearly and concentrating, restless and jumpy, slower heart rate, more hungry and gaining weight. Just like you would see with somebody who smokes, it's the same exact thing with vaping. They will show a sensitivity to caffeine as well, so that's interesting. And they'll be thirsty all the time. So some telltale signs that maybe a kid has started vaping is a different smell, some sensitivities and thirst, and then typical withdrawal signs you would find with regular cigarette use. They also may have some interesting paraphernalia on them. You might find little metallic wires and cotton wicks that they can use to modify the heating element. You might find small empty plastic vials. They may discard those atomizers. You might find these weird little things around. Might have some really odd batteries or chargers around that don't seem to go with anything else you might have at your house or in your classroom. And unfamiliar objects and pens that don't write, obviously, or odd containers. So, kids that just have book bags full of pens, and yet they never seem to write with those pens. It's quite possible it could be a vaping device. And there's lots of instructions online about how to hide your jewel in school. Kids will hide, they're so small, as we saw. You can hide them in empty containers, such as floss dispensers, soda bottles, inside a deodorant stick. You can hide them inside a Sharpie, an actual like Sharpie you would buy at the store, and you can actually still use the device when it's hidden inside of a Sharpie pen. So the interesting thing about these devices is they can hide them in really common things, but then they can actually still use them within these common things. So it's just another layer of hiding them. As we mentioned, it looks like a USB drive, so they could have them hanging off the side of their backpack, and it wouldn't be clear that it's an e-cigarette. Kids, lots of instructions online on how to smoke in class or in the hallways. People will pin them under their shirt collar or a bra strap So all they have to do is kind of tilt their head to the side a bit, and they can take a hit off of the jewel, and it's just discreetly pinned in their clothing, and it's virtually impossible to see. They would put them on the shoulder strap of their book bag, so walking down the street, they can easily access it. I could have done 2 hours on all the different ways to hide them, but these are some more of the common ones that you'll often see. And then as far as safety at home, as we mentioned, the nicotine oil is very toxic, and these devices don't have childproofing on them. So if you do have a teen that uses, or a family that uses e-cigarettes, it's important to really think about safety. They have to be out of the reach of children. If you use them or refill them, do not do them around children, because just having the oil on your hands can be enough of an irritant on a child's skin. If you touch them afterwards, that it can be problematic. Obviously, don't use e-cigarettes around children. And the CDC report recommends keeping the poison helpline available. We're kind of back to making sure people have that. If e-cigarettes are around in a household, or you know of a place where they're often used, it's important to keep the poison helpline available, because accidental exposure and ingestion is incredibly dangerous. So let's jump into e-cigarettes for cessation. That's been the big narrative that's come out. This will help folks stop smoking in a more safe and healthy way. This could turn out to be very true. However, at this point in time, e-cigarettes are not an approved smoking cessation tool. You cannot use an e-cigarette for smoking cessation for two reasons. One, there's conflicting data. Some studies show that these may aid cessation, whereas others show that e-cigarette use actually increases or prolongs cigarette use. We don't have smoking cessation data for teenagers, so this is more adult-related. As we know with teens, if they use e-cigarettes, they're more likely to start smoking, so cessation, we got a real mess there. But the data is very conflicting. And again, it kind of goes back to what we talked about a while ago, that it's hard to study because all these devices are so very different. How do you recommend an e-cigarette when you're not even sure how much nicotine is in it? There are no protocols, that kind of thing. And the big reason why you can never say that e-cigarettes can be used for cessation is because the FDA regulates smoking cessation devices. For example, the patch. These are considered drug delivery devices. Therefore, manufacturers cannot market e-cigarettes as a cessation aid, or they will violate the law, and the fines are quite steep. You cannot sell a drug delivery device without FDA approval. So for a manufacturer to say this will help you stop smoking is against the law. They cannot do that because the FDA regulates all of those things. Now, people are studying them as cessation tools, but right now, people can't make that claim. And if folks say, well, I can use it to stop smoking, maybe, but right now we can't make those claims at all. So let's round out today with prevention efforts. So what are we going to do about this? Unfortunately, as with all things in prevention, we're trying to catch up with whatever is hitting the streets in order to prevent it. So what I'm going to show you guys is just a lot of the things that are out there right now specific to e-cigarette use. So from the Substance Abuse Trends Alert, and you guys will have these links at the end of the page, at the end of the presentation, so you can see them. We found that Florida has made dramatic strides in reducing youth cigarette smoking. Lifetime and 30-day use among middle school and high school students has dropped. These prevention efforts are working, so it's very exciting to see. Public health impact is important. We need to understand for any prevention efforts what the public health impact is. That helps fund prevention efforts, that helps stimulate prevention research. And what we know is that there's an increase in youth exposed to nicotine. It is leading non-smokers to start smoking cigarettes. Sustained nicotine addiction to smokers who continue to use them instead of quitting. People aren't quitting. And it is a likelihood of former smokers to start smoking again. So if someone used to smoke and they decided, they miss it, but they don't want to get back into cigarettes, they're going to do vaping instead, we found that they'll start smoking again. So the Surgeon General is saying that there's a serious public health impact, so we need prevention efforts. What do we want to avoid, though, if we're trying to put prevention programming in place? We cannot put anything in place that is punitive. We have endless reams of research that show us that punitive approaches don't work. And we have learned this through very, very difficult trial and error with smoking prevention. And they're saying the same prevention efforts apply here as well. So punitive approaches are just not going to work for us. For example, there are some prevention efforts out there now. They put vaping detectors in bathrooms. There's some folks that now market these detectors that can detect the vaping and set off an alarm, and then the youth will get suspended. People are on the fence about that. They're saying that's similar to smoke detectors in bathrooms with cigarette smoking, and there's concerns that using those same kind of approaches is not going to work. So we need to be very mindful about what prevention programming we put in place. What's recommended is more of a social emotional learning approach. And this is incredibly important with vaping because kids just, as I said repeatedly, they don't understand what vaping is. They don't understand that they're getting nicotine. They don't understand that it's something other than just a flavor. So we want to work on that self-regulation. We want to work on the problem solving. We want to work on the communication and peer refusal skills, and we want to do that education, that information on vaping. Those are the four social emotional learning steps we need to take to have effective prevention efforts with these devices. So there are a few on the market, kind of market-ready ones already. So Stanford Medicine Tobacco Prevention Toolkit. It's free. You can download it from the website. It's a 6-unit prevention program that you can use with youth. It's all about, it says tobacco prevention, but they have an entire set of modules on e-cigarettes. As you can see, there's 6 units. Where did these vape pens come from? What's really in them? What's bad? Why does this matter to me as a young person? What can I do about it? And then some specific modules about joules. You can download the whole thing. You can get the whatever modules you want, but it is free on their website, and the links will be in the last slide. SWATFlorida.com has fantastic resources. This is a statewide youth organization mobilizing and educating youth to kind of de-glamorize it. There's resources, there's events, there's videos available. You can go there to get some great resources to help any teens that you work with. CATCH, it's Coordinated Approach to Child Health. They have, most of their programs are you have to pay for. Their e-cigarette ones are free, which is wonderful. So they have Catch My Breath, that's for middle schoolers, and then they have a Catch My Breath for high schoolers. It helps build knowledge and skills to resist those media influence and peer pressure. It's to be delivered by teachers, nurses, or counselors. There's training materials, policy guides that you could use if you need to develop policies for your agencies, parent resources, evaluation tools. There's signs you can hang up, facilitator guides. There's a whole bunch. There's a physical education supplement. There's a whole bunch of stuff in there. You can download the whole thing, pick and choose what you want, use the whole curriculum, whatever fits your needs. Stillblowingsmoke.org, California has really jumped on the vaping, so they've had this up for quite a while now. Resources, videos, educational guides. So you can go there for just specific information about vaping, or you can get actual educational guides. You can use their videos. It's all open to everyone. And here are the specific links to those, so you guys could get those easily. As far as helping quitting, so if somebody's already started, we had that great question during the break, can we use smoking cessation medications? Like I said, the jury's still out on that one. But we want to be able to help people quit. So what can we do in the meantime? teen.smokefree.gov has created a smartphone app that will help with vaping. It's also for cigarettes. But it's a web resource to help kids stop. It has specific tools for quitting. It helps them make a plan for quitting. It's kind of a game in a sense. They get badges for smoke-free milestones. They can include their plan for managing slip-ups, managing cravings. It offers distractions, including games and challenges. So if they're starting to feel triggered or they want to use, they can go into the app and be distracted to hopefully get them through it. They can build a personal quit kit. This is something they can do on their own. This is something they can do with a support person or a counselor. You can help them set up this app for quitting that is shown to be pretty helpful. Tobacco-Free Florida has tips for quitting, tools and resources, educational materials, how to support someone you know, really great resources there as well to help somebody who wants to quit. And those are our resources. So we have about 15 minutes left, so I think I'll wrap up because I know we have some things we need to do towards the end, or if anybody has some other questions, we can put them on the screen. But here are our take-home points. We covered a lot today, but the things that we really need to understand if we're going to help teenagers stop vaping, which is, as the FDA has said, has become an epidemic, we need everyone to understand vaping is not safe. Whatever we have been led to believe about vaping, that it's just a vapor, it's fine, it's just not true. There are dangerous chemicals and there's a high risk for abuse. We need to understand that teens believe it is safe, though. So they don't connect the vaping to nicotine use or smoking behaviors. So we know it's not safe. They believe it is safe. We have that disconnect. We have to bridge that gap. We have to help them understand, and we need to know that teens who vape have an increased risk of becoming smokers and an increased risk of using marijuana. That's pretty clear. And that our prevention efforts that we put into place have to be that psychosocial approach. We have to educate first, because teens don't even know what it is they're using. We have to help them with peer refusal skills, because as we know from the data, the current peer environment supports vaping and sees it as kind of cool. It's not ostracized or looked down upon. So it's going to be really hard to start to refuse your peers if the culture still supports it. So we have to work really hard on education and helping kids figure out how to refuse their peers. And they need to understand how to read the media and the marketing so that it doesn't have as much of an influence on them. So let's see here. Resources, lots of the things I mentioned. So you can find lots of resources here through the links. We also list all of the references, so you can go direct where there was a link to the article specifically. I've included that. Otherwise, you can just look them up. But there's, I think, 3 pages of the references, so you can see this data up yourself. But yeah, my contact information is on the front slide. If folks have questions down the road or we didn't cover something you want to learn about, always feel free to contact me and let me know. And I'd be happy to answer them. So I think that's all I have for today.
Do you want to do a round of Q&A?
Yeah, that'd be great.
All righty. If participants would just post your questions in the Q&A chat for the host's convenience.
I just saw someone post, actually, that there's a Students Working Against Tobacco SWAT in Florida. They have a new campaign out against e-cigarettes called Not a Lab Rat. I actually watched that one online. It's really good. It's at www.swatflorida.com. But yeah, they have some good videos out about that. So thank you for posting that.
All right, if there's not any questions at this time, I'd like to thank the presenter. And if she doesn't have anything else, I'm going to go ahead. Oh, we got a question coming in. There we go. There it is.
That's a good question. Can I get the audio recording of the webinar?
Yes, it'll be posted on FATA's website within 5 days. I'll go through that. I'm about to run all through that right now. Let me go ahead and did you have anything else that you wanted to present?
No, that was it. Thank you all for coming,
right.
And I hope you can use the information. Thanks.
And thank you, Jaime. Before we all go, before we conclude business, when I've concluded today's webinar, your browser will take you to an evaluation on FATA's new website. If you want to receive CE credits or statements of credit for this event, please complete the evaluation. You will be prompted to register or sign in to complete the evaluation. You can register as a visitor at no cost. For CEs to be reported to CE broker for FLA licensed healthcare practitioners, you must provide an accurate Florida Department of Health license prefix and number the first time you register. After you register or sign in, you will be directed onward to the evaluation. You may consider using the same email address when you register for the webinars through our WebEx link, and when you set up the profile in Psy.D's system, this helps connect your attendance and your profile. You will get a second opportunity to complete the evaluation through a follow-up email later today in about 30 minutes. The sender will be Messenger at WebEx. Evaluations will close at midnight, Tuesday, October 23rd. We do not email statements of credit. Instead, after we verify attendance and completion of the evaluation, a statement of credit will be generated as a journal entry within your profile. And there's the slides that went over there. Sorry about that. And once again, thank you for participating in today's webinar. We'd also like to recognize and thank especially the Florida Department of Children and Families Office of Substance Abuse and Mental Health for funding today's education. Have a great rest of your day, and please hold for the evaluation.